This is Mayor Warren, and I've convened all of the departments of the city of Orange Township and their directors and essential personnel to have a briefing on what they're doing in response to the coronavirus COVID-19. This virus is serious. The city is taking it seriously. We are receiving mandates, orders, and direction from both the federal and state government. We intend to fully comply. And there are also local measures that we intend to take in order to make sure that we slow at least the spread of this virus. We understand that it could get worse. Things are progressing to a point where there could be a quarantine, and we in the city of Orange Township want to be prepared. With that said, I'm going to go department by department and talk about what's happening in those departments, what these citizens need to know, and whether or not there are any outstanding issues that have to be dealt with. I would first like to deal with the police department to determine what's happening on the law enforcement.
In terms of the police department, all vehicles are equipped with personal protective equipment available to officers with training on its proper wear, removal, and disposal. We've increased the frequency of disinfecting patrol cars, holding cells, locker rooms, break rooms, and other agency facilities to reduce exposure to the virus. Presently, the Orange Police Department is closed to the public, to the general public.
When you say closed to the public, what does that mean in terms of people who want to file a complaint, domestic violence, and those types of issues?
They can call, and then we can dispatch an officer to that location.
Okay, so you're still open for business in terms of taking complaints and protecting the public?
Yes. Yes, we're still open for business. We are still focused on our mission, which is to provide safety and security to the citizens of the city of Orange Township. We've also developed a contingency plan for staffing shortages. We're coordinating with national, state, and local authorities to ensure accurate and consistent information. We're maintaining consistent communication with local health departments and emergency services to keep officers informed of the most up-to-date response protocols. We're also coordinating with the government agencies responsible for maintaining critical infrastructure, i.e. water, power, and transportation, to understand their contingency plans and potential for increased burden on emergency services. We're addressing officers' physical and emotional well-being as well. We have our chaplains on board in terms of counseling, and we're also utilizing the employee assistance program if someone is in need of any type of help as a result of the difficulty of the times that we're facing. And we have Lieutenant Mooney here also, who can elaborate on our tactical operations and anything relevant to what we're doing.
Will you also be able to speak to the curfew and how we're operating under the curfew?
Yes.
Yes, currently, for a long-term plan in place, we've been distributing the messages, as we said, to our email system, our roll call training to our officers, so they have a clear understanding exactly what they're doing, what questions that they're getting from the citizens and the public. As far as the 8 o'clock curfew, it just began. We've been lenient. We explained the curfew when we encounter people out there. As time goes on, we have city ordinance violations that may have to go in place. Parks are especially important places that we're checking. We have a two-man unit that goes out to each location, driving around checking on those units. In a more long-term plan, we've started to put a plan in place for a changing of shifts, using our special police department, our special officers to supplement patrol. If in fact we had an officer or a group of officers that were out for an extended period of time, we're putting plans in place so we can still function and use all our resources within the department, special units. Everyone would become part of the uniform division at that point.
Director, please explain to us what's going to happen during the daytime. I understand that schools have been closed except for reporting to schools to receive meals. Other than that, it's my understanding through the order, we'll get legal to come in later. What are we doing with children that we find who are on the streets and not home during the school day?
Children who are on the street will be engaged by police in a professional and civil manner. They will be taken home or brought to headquarters. We're also working with our local clergy to get them involved. The ideal situation is to take these young people to the church until we can contact their parents, and then the parents pick them up, and there'll be some sort of intervention that takes place to ascertain why that young person is out in the street where he or she should be at home, doing a very serious situation, a crisis situation.
So the objective is to try to get them safely with their parents, not engaged in law enforcement.
Right.
Thank you. I would like to jump to housing. We have the Housing Authority, which has at least 7 senior buildings, and then other buildings where the population includes everyone from baby to seniors. I want to find out what special circumstances they're facing and what, if anything, they need from the city, and what operations our citizens need to know about in the public housing area. So we have Walt McNeil, who is the Executive Director of the Orange Housing Authority.
Okay, thank you very much, Mr. Mayor, for giving us an opportunity to talk about what we're doing at the Housing Authority. First and foremost, our obligation is to provide safe, decent, and secure housing for all of our residents according to the federal government, state government, and our own policies. So what we've done early on is we've restricted use of our buildings, our community spaces, and we've restricted entrance into the building to only essential people who are providing nurses, aides, and people who are providing health care.
Are those restrictions posted at the buildings?
They are posted at the buildings, and what we've done, we've increased the number of security guards that we've had. We have on staff from now until this thing is over, so that we have the social spacing that's required. So we have one in the booth and another out in the lobby, so we direct people to where they have to go to.
Now, if I have an elderly, a loved one in the Housing Authority homes, am I not able to visit, or how does that work?
Well, if you're providing food or essential care to the person, you are able to visit. However, you know, as we have found out over the years, that people just want to come into the facility, but because of the problems that we've that the federal government has outlined, they want to really restrict the amount of guests in our buildings.
Now, just let me try to understand policy-wise. Does this policy come down from the federal government through the Housing and Urban Development, and then you have to implement it based on your neighborhood standards?
Well, it's a policy that they've asked us to put together, the Housing Authority Board and administrative staff. They want us to have policies that make sense to our local communities, because every community doesn't have a 10-story building like ours, where they have common hallways and big community spaces for people to get together. So we've restricted the use of the community spaces again, and certainly we met with most of the residents and we talked with them about it, and they've basically all agree that this is what we're going to need to do in order to get better.
So you've had conversations with the tenants associations and other
Yes,
interested residents?
Absolutely, with the majority of the residents. And this was going back over 2 to 3 weeks ago, when it didn't appear to be as serious from the federal government perspective.
Now, you have a large concentration of seniors. Can you tell us about any special cleaning efforts you're undertaking? And what about transportation to doctors' offices and groceries?
Well, we do have a large concentration of seniors, but it's still independent living. And believe it or not, a number of our seniors do drive and they get out, and we have not restricted them from leaving the building. So they can go out, get to doctor's appointments, see family if they want to. A lot of our seniors do babysitting for their grandchildren, and some of that could also create problems, but we haven't restricted that as of this point. We've told people to respect the social spacing issues, and we don't want people to congregate in hallways, in our community centers, or anywhere where they could pass on the virus to folks who are in the building.
And if the public or if anyone in the building had any reason to contact you, what's the best phone number or email address?
Okay, the best phone number is 973-677-4577. And certainly, my email is wmcneil@HACO, it's HACONJ.org.
And the 677 number, is that a 24-hour number?
Yes, it is.
So that can be used as an emergency number as well?
That is not an emergency. I have another number for an emergency number.
What's that number?
And that's 908-670-0345.
Say the number again?
908-670-0345 for emergencies.
So the Housing Authority, to contact them generally, it's 973-677-4577. That's 973-677-4577. And for emergencies, you may contact either Walt McNeil, the Executive Director, or his staff at 908-670-0345. 908-670-0345. Thank you, Mr. McNeil.
Yeah, and Mayor, I did want to say to you that we have adopted the city's social spacing directive. So our staff we've separated our staff and we're alternating their attendance at the offices. And we're not actually seeing our participants. So what's happening is if they want to see us, they can call us, they can mail in their recertifications and those sort of things, so that we can continue to do business.
Now, during this period, if there's confusion about recertification or rent payments, are we halting evictions? How are we working with that?
Right, we're halting the evictions. Well, first of all, as you know, the courts are shut down, so there's not going to be any evictions, and we're very sensitive to the issue of folks being evicted. We don't want to do that by any stretch of the imagination, so we are halting all those things mentioned above.
Thank you very much, Dr. McNeil. In line with some of the issues facing our seniors, I'd like to hear from our Department of Community Service that covers every segment of our community, from children all the way through seniors. Wendy Sykes, please give us a report on what's happening in community service and some of the issues that you're facing.
Thank you, Mayor Warren. The Department of Community Services, in response to the mayor's directive and to the COVID-19 coronavirus pandemic, has undertaken the following steps in abundance of precaution to comply with the state, county, and local regulations in an attempt to keep staff and residents safe during this uncertain time. So in our Division of Recreation and Cultural Affairs, we have canceled all community events, sports practices and games, trips, and safe haven and 6 to 9 extended day programs. The Health Department, applications for birth, marriage, or death certificates can be obtained via the city's website and or mail to our office. You are able to pay online via credit card for those certificates. Marriage and birth certificates are sent via email, USPS mail, not email, via USPS mail. Death certificates are picked up at the door by the funeral home directors once they have been prepared by our registrar. Copies of marriage or birth certificates are sent via mail. If our vital statistics office is closed, residents can get a death certificate or a VIP birth certificate, which is a birth by a home birth within the last 2 years, from the West Orange Vital Statistics office. And my health officer will also speak to additional collaboration.
Is that information posted on how we get death certificates or birth certificates or marriage? Is that information posted at the window when they come to the office?
No, it's not posted, but we can post that.
Okay. Please
It's on the website.
Okay. Please just post it so that when customers come up, they know before even walking into the
The mobile animal clinic has been canceled. The Humane Society has canceled their services as well for now.
Now, is there a place you can go if you need those services?
Not at this time.
So they just canceled, they haven't given us any other
Right,
information?
so, Humane Society deals with a lot of different municipalities, and they canceled their services. And so a lot of, municipalities in the area are also canceled.
Now, your office also handles animal licenses, pet licenses, correct?
Yes, sir. So, the mobile animal clinic is canceled. Okay, all routine environmental inspections have been canceled and will address any emergency situations. The animal licensing, we're working on getting that online, the application. So that should be online by the end of the week.
If my license expires prior to that, am I facing any penalty?
No.
What is my recourse?
No, just, once we have the application up by the end of the week, download the application and reapply.
So you're not enforcing
Penalty.
any penalties and fines?
Enforcing penalties at this time. All routine environmental inspections have been canceled. However, we will address any emergencies. I thought that bared repeating. Restaurant licenses will be mailed, and our visiting nurse program has been modified. We are not going out to the homes. She will, however, execute wellness checks via the telephone.
Okay.
Our older adults,
And if there's need of the public nurse, how is the person supposed to contact me?
they can contact the health department at, you want the number?
I'll get the number at the
Okay. Older adults, we've canceled all senior events and trips until further notice. Medical appointments and grocery shopping transportation will still take place. However, we have made the following modifications to those schedules. The regular medical transportation calls are still, you can still call into the 973-280-3825 number to schedule transportation at least 3 days prior to your appointment.
So that scheduling of transportation must be done 3 days prior to the appointment,
Right?
and they must call 973-280-3825.
Yes, sir. Now, COVID-19 or coronavirus medical transportation or transportation protocol. Please do not call that number, the number that I previously gave, to schedule a medical transportation appointment if you are exhibiting symptoms of COVID-19 or coronavirus. The City of Orange Township will not provide medical transportation to individuals exhibiting those signs. Instead, call ahead to your physician. If you have a medical appointment, call the healthcare provider and tell them that you have or may have COVID-19 or coronavirus. Okay, this will help your healthcare provider's office take the steps to keep other people from getting infected or exposed. Also call 911 if you have a medical emergency. And then our shopping transportation schedule for seniors has also been modified. Our regular shopping schedule is now limited to shopping trips to the East Orange ShopRite supermarket only. You must call ahead to our older adults office, and that number is 973-266-4049.
What number is that again?
973-266-4049.
Now, what are the hours of operation for that telephone number?
You can call this number between 9:30 and 3:30 right now because we have modified hours at the,
That's 9:30 a.m.
City.
and 3:30 p.m.
yes,
And what's the number again?
973-266-4049. There's another extension, which is 4050, so that would be 973-266-4050. And you can schedule a pickup. Transportation will be provided with no more than 5 seniors per bus to keep with social distancing. And we have increased the number of trips scheduled for ShopRite runs in order to accommodate seniors at this time.
Now, I know your office was working on creative ways to have days that were designated just for seniors to some of the local supermarkets. Is that developing?
Yes, that's part of the schedule, and it would just be for the East Orange ShopRite right now.
And are you working with Orange grocery providers for the same kind of service?
We will be. We're working on a protocol for that. We have limited drivers. So my last point is that their restaurant, Anico Restaurant in Montclair, has donated 150 hot meals to seniors, and that meal transportation or meal delivery will take place today. We are identifying seniors who are in need of meals, and the meals are being delivered via older adult staff and DPW. In addition to that, McDonald's on Main Street has offered to provide 150 breakfast sandwiches to seniors 2 to 3 times per week for the next 3 weeks, and we are working on a protocol for that. We just need to be mindful of dietary concerns.
Thank you. Also, as part of community service, the public health officer is out of that office as well. We may as well jump to him. Vinny has been on the front lines of bringing information back from all of the sources of information to our town and make sure that we're also in compliance with all of the protocols that have been set forth by the CDC, by the World Health Organization, and locally by the OEM. Vinny, if you can just fill us in as to what is happening. I know there has been one confirmed case of coronavirus in Orange. Please let us know how that developed and what else is happening in the terms of public health.
Once we get notified that someone's getting transported, goes to the hospital, within 7 to 10 days, we'll get notification from CDC of the results. Once the results comes back, we will notify the person who's transported that they do have the virus. They'll either stay in the hospital or stay in self-quarantine. And then that's it. We are getting calls every day. People are getting the symptoms. They're saying they have the symptoms. They're getting transported, but as of yet, there's still only one positive case. There's still 7 more that we're still waiting for to see the results as they go by.
Now, you said we're waiting for the results. What does that mean?
It means once somebody gets tested, it goes to the CDC lab if they use it, which takes anywhere between 7 to 10 days. If they use a commercial lab, Quest or something like that, what they'll do is they'll take the test and it comes back positive. They're going to retest it and goes out again to confirm it. That's what's going on. We have a lot of people calling up saying that they might have symptoms, they're not feeling well. We'll rule out the 3, if they have coughing, fever, difficulty breathing. If they don't, have they been out of the country? If they say no, most likely we're still in the cold weather conditions. They might just have a fever. So that's going through. But otherwise than that, we're doing pretty good for a town our size. So we're doing very well. We've been notifying daycare centers to close down. We just sent a letter out to Senior Citizen Building restricting their people in their ballroom areas. So this way there's no confinement area with people hanging out in there. We also notified the schools if they can, if there's any special programs to avoid them. There's also, the governor passed a thing that there's no more special events for the next 8 weeks. People are
The next
gearing
8 weeks.
for the next 8 weeks. So we're telling people that. If there's a store emergency that they need to be inspected, we will go out there and inspect them, just to let them know. We're getting a lot of calls on the curfews and people at restaurants, if they can have food without sitting down. We're saying as long as they deliver it or people come in and take it out, up until 8 o'clock, it's fine. But that's it, no sit downs at all.
Now, we haven't done this yet, but can you just walk us through some of the precautions that we can take to make sure that we're safe and there's no needless exposure to the virus?
Make sure you wear gloves, avoid touching your face. If you cough, cover your cough with your sleeve. Avoid contact with people that you think are sick. If you're very elderly or people that have symptoms, we have a whole 2-3 sheets that we have in the health department. We're more than happy to give them to you. But especially the very elderly have to watch, and if they have symptomatic symptoms, they have to be aware. Only because you're walking by somebody 4 feet away, 5 feet away, doesn't mean that it should be safe. The droplets could go up to 8 feet. Okay, so this way you know. Always wash your hands, no matter what you do. As soon as you touch the door, and the virus can live, no one has said it, but it's pretty close to 72 hours, up to 7 hours, 7 to 72 hours on the surface. In the last 2 or 3 weeks, they haven't used it, but bleach is coming back again. They used bleach when we had the H1N1, when we had the big AIDS epidemic, but they haven't used bleach in the beginning, and now it's back out again. It's 4 tablespoons of bleach for every quart, 3/4 of a cup of bleach for a gallon of water to wipe down the surface. And don't just spray it and wipe it off. Spray it, let it stay on for 15, 20 seconds. The longer it stays, the more it's absorbing up what's ever there.
Thank you, Vinny, for that important information. All of you have spoken about items that are dealing with policy, and I do have the law department here. The city attorney, Gras Montelis, is here. Gras, I do want to just go through with you some of the issues that we're facing. I know we received 2 executive orders from the governor. There have been complaints about prices in stores, and there have been some issues around our curfews. Just legally, please tell us where we are, where we stand, and taking some of the precautions that we've been recommended to take.
Sure, thank you, Mayor. So, as you indicated, so we have in fact been closely monitoring the executive orders that were signed and issued by the governor's office, particularly 103 and 104. Executive Order 104 was recently signed by the governor on March 16th, which is this past yesterday, as a matter of fact. And what that actually addressed specifically, and we've talked about it already, is a curfew, not only with respect to certain businesses, certain establishments, setting guidelines as to what we as a community should follow. So the law department has again reviewed those executive orders and make sure that we are in compliance with what Governor Murphy has mandated. With respect to the establishments, again, as was outlined by our health officer, certain restaurants, not certain restaurants, all restaurants are in fact limited to takeout, no sit down, takeout services, and they are establishments. Certain establishments have actually been ordered to close permanently as of yesterday, and those include, at least with respect to our city, those include gyms, theaters, etc., and other casinos throughout the state. Certain establishments have been ordered to close permanently. Other establishments, again, the curfew is from 8 p.m. to 5 a.m. There are essential facilities that are not included in the 8 p.m. to 5 a.m. mandate curfew. Those would be your pharmacies, groceries, gas stations. Those are not included in the 8 p.m. to 5 a.m. mandate with respect to closures. So that's something that we as a community, or our community, certainly need to be aware of those facilities that you can in fact access after 8 p.m.
There have been some concerns and questions that I received in my office about various grocery items being elevated in price during this period of time. Has there been any check, or is there any curb against doing that kind of behavior?
There is. So we have in fact highlighted and reviewed what's been termed as price gouging. So we are in fact contacting and working closely with the Attorney General's office to certainly make sure that that does not occur within our city.
So if we have concerns about that, do you have a number that can be reached? Some people may have questions. There's some constitutional issues whether or not this curfew can go in place. When those kinds of issues arise and our police are interacting with people in the public, what number is it that they can call to get clarity on those issues?
Certainly, Mayor. So the public should reach out to the Law Department, 973-266-4158. Again, that's 973-266-4158. I've also instructed and advised my staff of attorneys, as well as the non-attorney staff, with respect to the questions that may arise not only from the public as a whole, but also internally at City Hall, to be sensitive to the confidential nature of some of the inquiries, to also be incredibly responsive to those inquiries as they are made.
Thank you. I just want to jump back to the health department. Vinny, is there a number that we can contact the health department?
Yes, Priscilla and myself are there, and Stephanie.
Now, Priscilla is a public nurse.
That's correct. Her number is 973-266-4068.
That's 973-266-4068. And at that number, you can reach the public nurse.
For myself, it's 4073.
And for the public health officer, Vinny D. Filippo is 973-266-4073.
And that's after 4:30. It goes on all the way up until 8, 9, 10 o'clock. And for Stephanie, if there's questions on vital statistics, it's 266-4071.
So for vital statistics, which means birth,
Birth,
death,
death,
marriage certificates, that number is 973-266-4073. All of these numbers will be displayed on the screen so that people will get them and utilize them.
71.
I'm sorry, for Stephanie, vital statistics, 973-266-4071.
That's correct.
Thank you, sir. The city, while we are taking various measures to cut down on the closeness of employees, and while we've closed city buildings to the public, the city must still operate financially. So we have the director of finance here together with the tax collector. Mr. Mapp, if you could just give us an outline as to, we're running on a skeleton crew, but just some assurances that the bills are still getting paid, and what are our obligations as citizens and taxpayers to pay bills in this time of crisis?
Well, thank you, Mayor. First of all, the Finance Department is equipped to work from home, and we could access all of the systems that we need to in order to continue to provide the services that we provide in the Finance Department. The city must continue to pay its bills. We must continue to provide the services that we provide on a daily basis to the residents of the city of Orange. And to that end, property owners, taxpayers are still required to pay their property taxes. And in light of the fact that City Hall is on a modified schedule and that the public is not allowed into the building, we are looking at providing collection boxes here at the police department that will allow property owners to still keep up with their obligation to pay their taxes. They will be able to do so by depositing those payments in boxes in the coming days, maybe in the next 24 to 48 hours. We are also making sure that employees who still have to support their families are going to be paid on time. And so we are also committed to making sure that any and all departments across the city who need support in terms of the procurement process, that we will be able to continue to provide that support so that we could get the materials and everything that we need in order to run this city. So finance is able to provide the needs to all of the directors, all of the departments, in spite of the fact that we're operating on a modified schedule. We are ready to do what is necessary.
Will, I don't know if this is best for you or for the tax collector, will we engage in collection efforts regarding delinquent taxes and delinquent liens?
Yes. We encourage all taxpayers now more than ever to pay their taxes online. You can pay with a credit card, you can pay with your check, your routing number, and your account number. As far as liens, they can also, well, you would have to pay that in person actually, so how we would figure that in. But paying your taxes online is very easy, and we encourage all taxpayers to do that.
And Paul, who are you?
The tax collector.
What's your name?
Paula Ferreira, tax collector.
So I'm directing that during this period that we do not, because the lien process gives the city the authority to foreclose on a lien and potentially engage in a foreclosure process whereby titles transfer.
Yes, that's correct.
And so I'm working with the law department to make sure that process is halted so that no one loses their home in this process, and that we figure out a way that we can make our payments even though City Hall is not open. So there's no concern about someone losing their house or their liens growing to a point where they can't afford it, because we're going to stop that process. And people that are in that position, I'm asking the law department together with the business administrator and finance to communicate to them what our plan is going to be going forward, so that everyone knows and no one is in jeopardy with respect to their homes.
And Mayor, if the public has a question as it relates to finance, they can feel free to call me, the director. I'm Adrian Mapp at 973-266-4011, or you can reach me on my City of Orange cell phone at 201-618-5264. You can also reach our Chief Financial Officer, Niall Clements, at 973-266-4245.
So let me get those straight. We have three numbers. The finance department, if you have any issues, that covers payment of water bill, payment of taxes. It could cover you if you're a retiree with your pension, benefits, and employees. Is that correct?
That is correct.
That number is at the finance department, 973-266-4011. You can reach Mr. Mapp directly. That's 24 hours. He may not pick up immediately, but you leave him a message, he'll get back to you at 201-618-5264. And Niall, who is in finance as well, at 973-266-4255. And he is
4245.
4245. That is for our CFO, correct?
That is correct.
For Niall Clements. Thank you very much. So that our operations are in effect and strong. We're making sure that no one is hurt in the process. I do now want to jump to the fire department, who has their boots on the ground, to talk about how we're handling emergencies. They are also responsible for the ambulance service, and to make sure that we're able, in the event of emergency, to be able to handle it. Our fire director, Kenneth Douglas.
Thank you, Mayor. Good afternoon. At current, through the Mayor's directive, the City of Orange Township Fire Department is closed. Although we're a 24-hour business, the business office and fire prevention, residents cannot come up there. It's restricted, but fire operations are still going on.
Now, you say fire department is closed. That
Yes.
means that the public can't visit the building, but firefighters and yourself are operating the fire department as usual.
Absolutely. Fire operations are still current, 24 hours, 7 days a week. The business office with fire prevention, where you get your permits, pay your fees, that office is closed. Will only be operating through telephone. Individuals who need business with the fire department, they're to mail or call the fire department, and the return certificate will be sent to you. In the event of emergency, I encourage all residents to dial 911. In the fire department, the main numbers to call if you have any issues, or the non-emergency number is 973-266-4230. My personal cell is 973-868-1401. And those residents that need to do business with fire prevention, if they need permits or pay fines, 973-266-4243.
Now tell me how, if I need to get an inspection from fire prevention, how's that working? Or fire inspection, how's that working?
Well, actually, inspections right now has been ceased due to the coronavirus. Our inspectors are not inspecting any buildings at this moment, but paperwork can be submitted for future inspections. We don't want to put the firefighters and the inspectors in harm's way. And so they only can do business through the fire department through telephone.
Have we directly spoken to the people who have pending permits to let them know what the status is?
They have been calling the fire department and fire prevention, and they've been notified. It needs to be posted on the city's website.
Tell me about the ambulance service.
Okay, I will extend that to the executive officer of the fire department, Matthew Kohout.
All right. So the ambulance service is just to start off, St. Clair's has taken over, and they've been doing a great job for us. Our calls have our medical first responder calls have, over 90% of the time we're showing up and they're already on the scene. They're doing a fabulous job.
Now, this is a new ambulance service.
Yes, it is.
When did they start?
They started
Mid-February.
Yeah.
I mean, mid-January, I'm sorry. This 2020.
They have new and improved vehicles, new and improved service times.
They have 2 new ambulances, fully staffed 24/7, and they have a supervisor at this point still 24/7 for us. And they've been extremely professional, and it's really been a blessing with the current situation we're facing right now. I've been in contact with them and with the dispatch to see what they've been doing different. So this is an evolving thing, obviously. As I'm sitting here, I'm getting a message in about the new questioning and new procedures. So it is no longer, they feel it's no longer necessary to ask if you've traveled out of the country. That you more or less ask if you have the coronavirus or you have possibly been exposed to the coronavirus. EMS, the dispatch is screening the calls. If they suspect the coronavirus patient, they notify the ambulance by pager so they can prepare for that call and be fully suited. If they have the call, they have to decon the ambulance. The members come out of service. So there's a potential for us to start receiving more calls where they're not available.
If someone suspects they may have it, or if they've been infected with the COVID virus, are they picked up by ambulance?
As of right now, I believe the recommended, if they need to be dispatched to the if they need to go to the hospital, that they go by ambulance. Some people it's not being recommended that they go to the hospital. For the younger you are, the less affected you are by the symptoms normally.
For older persons, could be transported by ambulance.
Older people are people already compromised health-wise.
And Mayor, just to add on to that, some of the local health facilities, not going to name any names, it's best to call ahead opposed to just going there, because they're steering people to their central office opposed to the local ones. One is that's in West Orange. They're sending those individuals to the Springfield location. So if the residents try to go up there and want to get seen by a doctor, if they think they're symptomatic, the doors are locked at that facility.
It is recommended that you call ahead prior to going to any location, whether it be a hospital or your primary physician or a care station. They want you to call ahead, and there are some places doing phone interviews and clearing people that way.
Is there a number that we need to have to contact the ambulance directly, or do they do it through the numbers that you provided here?
I would say dial 911. That'd be the more direct number. And from 911, it'll go through the dispatch, and then the ambulance service will be notified. Recently, we've been getting calls straight from the health department, and we've been calling the ambulance service directly to get assistance to the person who think they're symptomatic.
And I didn't ask this of every director, but have you found that all the directors within the city of Orange are in contact with each other and trading information and making sure that we're responsive?
Absolutely. I'm in direct contact with the health director, Vinny, also with the Office of Emergency Management and Director Warren in the police department.
All right, thank you. Fire has spoken, and they're working closely with OEM, with Department of Health. Um, there's also another important department, the DPW, Department of Public Works. And they're primarily responsible for all of the city's buildings and a lot of the operations. So I do want to refer to Marty Mays, the Director of the Department of Public Works. Marty, what are we seeing in Public Works? Anything that we should change? And what new issues are you facing as a result of COVID-19?
Thank you, Mayor. The first thing that I want to let the residents know is that your services are going to be delivered. We're still going to be out there sweeping the streets, collecting the garbage, dealing with your recycling, and all the other services that DPW provides. Until otherwise noted, those things are going to continue to happen on their regular basis. Relative to COVID-19, some of the things that we're looking at is definitely making sure that all of our employees are safe in the buildings as well as the residents. We're looking at special cleanings of the rugs, cleaning of all the different touch points, and we're trying to focus in on the bathrooms in the public buildings, upgrading the facilities so that you eliminate the touch points. We trying to think long term because this virus is supposed to be around. It's supposed to come back again. So we're trying to think long term from the beginning. Of course, adding hand sanitizer units. Thankfully, we believed in that prior to this, and we had a couple, but now we more than doubled what we had. We also been working on making sure we secure different cleaning supplies for police, fire, and the city. One good thing is that we've always tried to keep a surplus of it, so we didn't have to go out on a big rush to get stuff because of what's happening now. We also looking at trying to do as much as we can for the delivery of services for the residents via computer, email, fax. We're looking at specifically the C of H's and sales inspections, since that's one of the things that are constant within code enforcement department. The picking up of your parking permits. If you need to do that, you need to contact Hanifa Norman, 973-266-4051. We also talking about, we actually have suspended all interior inspections for code enforcement. We're only going to be focusing on the exterior. We're looking at different ways to.
Have we informed the public about the suspension of the interior inspections? The ones that are pending, or do you have a call?
We did make calls today, and I think we made calls the day before that.
We have intentions on putting it up on the website by tomorrow.
And I'll let Ray go into the redeployment of the men and the different duties.
Yes, so as of Thursday, we reevaluated the table of organization for the Public Works Department and redeployed people to have continuous service to our residents. So we redeployed 10 people to the buildings to do everyday wipe downs to make sure that citizens, residents, and employees are safe.
And you say wipe down, what are they using to wipe the buildings down?
We're using bleach solutions, as Vinny mentioned, so we're using bleach solutions to continue to wipe down.
Is that in the elevators, in the corridors, on the stair rails? Where is that?
On everything. Elevator, corridors, stairwells.
So every surface is getting wiped down from
Yes, sir. Yes, sir. And also, we limited one person to the elevator at a time for the distance. Yes.
Will the city continue to pick up garbage and bulk
Yes,
on
so there
the
will
designated days?
There will be no interruptions in services at all. So we have redeployed guys to make sure that we continue to fill potholes, pick up refuge, make sure that we actually closed the parks as of yesterday.
In terms of calls for service that people make typically to DPW, how are those being handled? I know you get a lot of calls for buildings that are not secured, for dumping sites and so forth. How are you handling those calls?
Yeah, so we still have clerical staff, even though we staggered the shifts. So there are 2 clerical staff on staff at all times, and they're receiving the calls, and the work orders are still going out to the supervisors.
And are you responding with personnel to those sites?
Yes, sir. I'm responding. If I don't respond directly, there will be a supervisor at every site at any given time to answer any questions or concerns of the residents.
And if there are questions or concerns, what number should they call?
Or they can contact me at 266-4030.
Is that the only phone number?
Or actually, you can
Neither you nor Marty have given me 24-hour numbers, so.
no, you can contact 266-4031 as well.
Marty, is there a number where you have 24-hour access?
Yes, it's 973-885-1921.
I just want to touch on one other thing because we
Well,
might.
let me just repeat that number.
Okay.
Already slipped it in. 973-885-1921 for Department of Public Works. That's the 24-hour number. There's also the office number you can call during office hours, 973-266-4051 or 973-266-4030.
So I know there may be some concerns because other businesses have let their employees off, so there may be some parking concerns. So we're reaching out to police to work with the police director to try to get the parking suspended. In light of that, we might go to a shelter in place, and the shelter in place is a quarantine.
Now, I know that your office also is responsible for code violations and inspections. What is the process? Has that process been altered as a result of COVID-19?
Yes, it has. So at this present time, we are just looking to get warnings out because we know some people might not get out to be able to get out to address some of the issues. So we're just going to issue warnings and try to work with the residents and to come into compliance with these issues.
And so if I get a warning, does that mean I have to pay a fine? Do I have to go to court?
No, that does not. It's just notifying you what needs to be done on that particular property.
So it's not a fine, it's not a penalty.
No, it is not.
And that'll be suspended till further notice?
To further notice.
You can speak to that too. So if I get the warning, what is the warning telling me?
Normally, the warning lets you know you have up to 7 days to abate the situation.
And if it's not abated at that point, what are we doing?
3 days, 3 days. Then we will come back out and normally issue a fine. But in light of this case, we're gonna kind of continue issuing continued warnings and keep a record of that. And after this situation is addressed, then we're gonna revisit it and then maybe consider then whether we should issue the fine or if the president had enough time to abate the situation.
Thank you. I don't have them here presently, but our law department does deploy the prosecutors in municipal court. Grass, if you would, just let us know what the schedule of municipal court is and what the process will be for violations in municipal court.
Sure. So with respect to the municipal court, the AOC, the Administrative Office, of course, has actually suspended all regular sessions for municipal courts pending further notice. They're actually suspended until next Friday to be revisited by the AOC. The only thing that's being handled right now through the municipal courts are the bail hearings and the detained defendants or detained individuals. What they can do, and also domestic violence applications and domestic violence issues, restraining orders, etc. What they can do, however, the municipal court building is open, in fact, for running of the businesses. But in terms of court sessions, the AOC has in fact suspended court sessions and court operations.
So will I get a warrant for my arrest if I don't go to court that I had a scheduled court date for?
You will not. No one will get a warrant for arrest. All scheduled cases are actually being reviewed and evaluated by court staff for rescheduling. So everyone had a court notice or had a court appearance scheduled will automatically receive notices for rescheduling of those cases.
And we don't have the court number, but can you give your number once again to call for people who have questions about court that you can then refer them to the court?
Absolutely. So again, the number for the law department is 973-266-4158. 973-266-4158. The director of the municipal court is James Moss. To the extent that the law department will either answer any and all questions regarding the municipal court or I'll certainly refer you to the Director, James Moss.
Thank you. We have been under a mandate from the federal government. This is the year 2020. Every 10 years there is a census, which means a count of the population of the entire country that's handled on a local basis. Here, in accordance with federal guidelines, we did appoint a complete count committee, and that's being chaired and coordinated by Councilwoman Adrienne Wooten. And part of their practice is physically to go door to door to get a count as to how many people live in our town. This committee and the work of the census count is important because that is how the budgets are determined. The federal government looks to determine where the people are, and that's where they send resources. And certainly we've been short resources, especially on the education level, for a very long time. And we don't want to suffer any shortages for any resources that we're entitled to. And therefore, we're looking for a complete count and a coordinated effort to make sure that everyone is counted and that we remove any stigmas against being counted and any perceived negatives about being counted. So if we could, Councilwoman Wooten, can you tell us some of the activities that are going on with the complete count and what, if any, modifications you had to make to the count in light of the COVID-19 virus?
Thank you, Mayor Warren. First and foremost, this in 2020 is the first time where it's the easiest for you to engage in the census without meeting a census taker. You can do this online, you can do it via telephone, you can also finish the application by mail where you don't have to come in contact with the census taker. In the city of Orange Township, we have reached out to several groups, but three key groups are the churches, the senior buildings, and the soup kitchens and the nursing homes. So with those groups, what we have done is in the churches, we will engage people during the hot food giveaway and the cold food giveaway in the churches. With the flyers and posters, we have several flyers and posters that are going to be drop shipped to City Hall. Posters will be put up in every business, especially on Main Street. Flyers will be taken out to homes that will be put on your doorsteps. As far as buildings, we will do this process with management and the superintendents of the buildings to distribute the flyers in the buildings.
How are you handling, what, do we count everyone? Do we count children and adults? How does it work with this?
It's essential that we count everyone. Everyone that's in your household, you need to be counted. And Essex County is known a hard to count county. Orange is definitely a hard to count city. So we would like for you to reach out to anybody and everybody and let them know that they need to engage in this process via online, telephone, or mail.
And as you go out to count, do you have the resources necessary, gloves, masks, and cleaning supplies to go door to door if need be?
We do. All of that has been given to us by the administration through grants and donations.
And finally, what about language barriers that you face in terms of contacting residents?
All of the posters and flyers that come in are in 3 different languages. We have them in English, Spanish, and Creole. Whenever we walk and knock, we have someone from the Spanish community with us, as well as the Creole community.
Thank you.
Thank you.
So please, be counted. We're mandated to be counted. We should do it because it's in our own best interest to make sure that we can get all the resources that we deserve. And the best way to do it is to be counted. The resources follow the population. To make sure that we are all in coordination in terms of resources and emergency needs and repairs, there is a federal Office of Emergency Management, a state office, a county, and we have our local office. Our local office is headed up by Mr. Padilla, who recently retired from our fire department. In July, when he retired from our fire department. I'm not pushing him out too quickly. But we're still tapping him to work because of his expertise and over 30 years of experience in the fire department. Sir, please tell us what is happening on the emergency management front, and please tell us what your role is in terms of communicating back to us what information you're seeing from the other levels of government.
Okay, well, Mayor, first of all, first and foremost, thank you and thank everyone in this room. You can only imagine the stress level in this room, in this confined space. But you know, we play two roles here. We play family members, household members, and then we have to come here and perform our duties. So that our stress level is through the roof. So I want to just tell everyone here, thank you for your dedication. And the city's very lucky to have you all here. Things are going to change. They're going to be modified. But I can almost guarantee, just being a fireman, that we will continue to protect, serve, and inform the public as much as possible. What we're doing is, what I want to just basically say for the residents is, it's very important. The governor has been speaking probably twice a day, every day since this really broke out. Please pay attention and follow directions. It's very serious, especially the hygiene. Remember to wash your hands in and out, limit your contact, try to confine your space, quarantine as much as possible on a volunteer basis. Benny, and I know you mentioned about washing your hands, soap and water, it's the best killer of germs. We're using these Perel, and we're using all these hand sanitizers. Soap and water is the best thing to kill germs. We ask the public also to be patient with us. This is all new to us. We are used to dealing with standard incidents, but this is something out of the ordinary. So we may make mistakes, but we'll catch them, we'll correct them, and we'll move forward. Just again, follow directions, check on your neighbors. If you suspect that you have the coronavirus, or someone that you know has the virus and you call 911, please make that known, just for the protection of those responders that are coming to you, so we don't become now a person to pass it on to the next person. So please be mindful of that. There are two sites. There's a lot of information going out there. Two big sites that we're paying attention to on the local level, state and county. It's the CDC.gov and the World Health Organization, which is int, who.int.
So it's WHO.int.
Correct. Those two are very up to date to the moment on the coronavirus. They have a lot of information, not only for public health individuals, public safety, but also citizens. The contact numbers, myself, the director, and executive officer Cohout have agreed to man the phones 24 hours a day. The OEM phone is 973-747-9332. Again, that's 973-747-9332. You can also email us at orangenjoem@orangenj.gov. Fire director, he gave his number again, Director Douglas, I'll give it again, 973-868-1401. Correct, Director?
Yes.
Okay, 973-868-1401. Executive Officer Cohout, 201-341-9240. His first true disaster. Welcome to the club. And also, if all fails, of this magnitude, if all fails, you can always call 911. Again, be mindful, we're not going to have the answers to everything. I have a pile of paper in front of me that I printed out just in one day of the updates. I'm sure that by tomorrow, I'll have another pile. So everything changes every single day, so be mindful that we're not going to have all the answers, but if you call us, we'll try to get you the best answer. We are in contact with the local, state emergency management service, the Essex County OEM office, and the New Jersey State Police Office of Emergency Management. Any incidents that we get through Mr. DiFilippo and our health officer gets sent over to the Essex County Command Post, and that gets distributed. And you have to be mindful, we do have HIPAA laws. We cannot reveal names and addresses of individuals. We are bound by that act. So be mindful that if you ask us, we're not going to tell you. As the mayor said, there was one individual that was identified, but that's all we can release based on that HIPAA Act. I just want to remind everyone that that this is not the time to point fingers, and this goes basically to the public. We will make mistakes. We will get by through this together as a community, as humanity. It's not time to point fingers. It's not time to criticize. It's all hands on deck. So thank you.
Thank you, sir. We have come together to make sure that we are doing our best to serve the public and to make sure that we get through this crisis together. It is a global phenomenon. If everyone locally did their job, hopefully we can stop the spread of this virus. One of the other departments that we look at in the police department is the crime prevention, and one of the largest social organizations and religious organizations is the clergy. And we do have a member of the clergy here, and because that's such a vital part of our community, everything we do socially, spiritually, our daycare, many of our outlets are through organizations that are faith-based. And I wanted to have them here to explain what changes we could face and what we can expect going forward in terms of how we worship, how we interact, and how we continue to build a civil community. So I have Reverend Ferguson from the Bethel Baptist Church right here in Orange.
Yes, thank you, Mr. Mayor. I was on a phone call last night with the United Clergy of the Oranges in the vicinity. Pastor Prescott Butler is the president. And one of the things that we talked about was how will we respond during this calamity? How will we continue to have worship? And what we've pretty much decided, most churches have decided to try to go to some sort of online platform or distance meeting, either Zoom, Facebook Live, or something like that in the midst of this. Each church is making their own determination, but for the most part, the consensus was that we would move to something like that. We have also been encouraging, I know in our church in Bethel, we are no longer having live Bible study. That'll be done by conference call and by Facebook Live. We are asking all of our members that have compromised immune systems or have had surgery or some sort of immunodeficiency to stay away from the church during this time and just be careful in their forays into the public. We've also been practicing social distancing and washing of hands, especially if we go through from a meeting requirement of less than 50 to less than 10. So some of the churches are going to just have, just the praise teams and the preachers come into the church and kind of film worship there and broadcast it live for the rest of their congregations. Also, the United Clergy of the Oranges has decided to cancel their Lenten services, which would have been held on the 18th and the 25th of this month. And they're going to have a prayer call by conference call. And that'll be on the 18th and the 25th, which is tomorrow night. And next Wednesday night is 6:30 p.m.
How can we get on that prayer call?
And the prayer call number is, the access telephone number is 319-527-2771. And the participant access code is 319-300.
Hold on 1 second. Now the phone number is area code 319.
Yes.
527-2771. And once I call that number, it rings and asks me for an access number. And what is that access number?
319-300.
319-300. So the phone number is area code 319-527-2771. And then the access code is 319-300.
Yes, sir.
That's for the prayer call that's being coordinated by the United Clergy of the Oranges.
Yes, sir.
Thank you, sir. If that completes your report, I would like to speak about technology. Technology is being relied upon in a huge way because people just can't gather, and therefore we have to default to technology to bring us together. And coordinating the technology for the city of Orange Township is Kim Fisher, and that goes from everything from our computers to our Wi-Fi to our telephones and everything in between. Kim, if you could just give us a brief scenario on how we're using technology to offset some of the functions that we couldn't do while we were together.
So for right now, as far as technology goes, all essential employees have the ability to work remotely, whether that be from a tablet or a laptop, also cell phones as well. In regards to meetings that would normally be held in person, we're now giving you the ability to work through a conference call on those meetings. We're flirting around with the ability to use GoToMeeting, Zoom, a couple other of the softwares that are being used right now to access those meetings.
Have we looked at any way yet to involve the public in public meetings? We can't gather and have public meetings, but is there any way that the public can be part of a meeting remotely?
Yes, so there is the ability for the public or residents to dial into these conference calls, and we can monitor the ability for them to ask questions or, talk during these calls. We do have for the council members, we have City Council at orangeandj.gov, which residents can use if they have questions regarding council meetings and things of that nature.
And if I only have a telephone, am I able to participate, or do I need a computer or Wi-Fi?
If you have a telephone, there's a number that you can dial into when the meetings are presented with an access code so you can access those meetings.
And we're also using robocalls.
Yes, we are.
And is there a way that we can use a robocall to inform people of what this number is when we have a meeting in advance of a meeting?
Yes, we can.
Thank you, sir. To wind up our presentation, the business administrator really touches each and every department from a budgetary standpoint, a supervisory standpoint, and an implementation standpoint. He is a person that I look to make sure we're all coordinated. I do want to have our business administrator come and present to tie up a lot of the issues and answer a lot of the questions that we have from the public and from inside the administration. Chris Hartwike serves as our business administrator, and he's here to give us a presentation as well.
Thank you, Mayor. First, thank you for your leadership. You had the foresight to have us working on this weeks ago. And for everybody who's in this room, there are at least one or two people behind these people who have been working for the last several weeks to be able to prepare an emergency operations plan in the event that things progressed as they have. So part of that preparation, you've heard multiple pieces of it. The overall goal was to be able to continue to deliver governmental services in the event that the pandemic became serious enough that ordinary life would be interrupted. We have put a number of things in place, as you've heard. The backbone of the plan is technology and the use of laptops, a cloud-based network that can be accessed remotely, smartphones distributed to all essential employees. Each department has presented potential problems as well as solutions for operation. There are a couple things that were touched upon during the department presentations that I wanted to reiterate. First, parking. If we move to suspend alternate side of the street parking, that will not be suspended on every street. An evaluation will be made as to whether or not emergency vehicles can access those streets. And if emergency vehicles cannot access those streets with vehicles parked on both sides, then alternate side of the street parking on those roads will not be suspended. It will, however, be posted appropriately. Otherwise, alternate side of the street parking will be suspended, and so will regular parking regulations. If all people are home because businesses have shut down and have people working remotely, we do not have enough parking spaces to accommodate all of those vehicles. We're not going to punish people by issuing parking tickets.
How do we get notice?
We will provide all notices via the website. I'm going to encourage people to log into the website on a regular basis.
If I don't have the website or I can't have access, can I get notice on my car, notice on the street with a sign? Is there another alternative way to get
To the extent
notice?
that we are still allowed to have public employees out, we will be distributing direct to communities, direct flyers for any of these changes. That will start, well, it already started last week, but it'll happen again this evening. We have a notice going out to people, which will summarize some of the things that we've gone over here today. In addition, we will use the robocalls as well as our 24-hour.
How do robocalls work?
We tape a message, we load it into a computerized dialing machine. We have a database of numbers in that machine, and the computer dials those numbers over and over and leaves the message.
Now, if I'm not on that robocall list, how do I get my phone number on the list?
You can go to the front page of the website. You will find a box that says you can sign up for notifications. You simply follow the prompts, put in your cell phone number or your home number or your email address, and you will either get a text, an email, or a phone call.
And if I want to, because I don't have a computer, I want to leave a message for someone to put my name on the list, how do I do that? What do I call?
You would call the 862 number. I don't have it in front of me, but do you have that?
I do. I'll get it right talking.
Okay. We'll give you the number in a second. But you would call that number, leave a message, and we will upload the data so that you get the notifications. With regard to tax payments, we will have established here within the police department payment windows. The reason we will establish them here is twofold. Number one, no matter what happens on the state level, this building will be open, and it is secured. So with City Hall not being open, if you need to make in-person payments, you'll be able to make them at the windows on the first floor of the police station, and we'll have that in place by the end of the week.
Will they have the cash register and be able to get change and process their payments?
We will have what we call a cash drawer, and yes, we'll have a computer there. We'll be able to enter the payments directly into the system and provide receipts. With regard to people who may need water, we're going to give you a number. That number is 973-280-2587. If you have a need for bottled water on a limited capacity, this is not a come and get 2 cases. But if you have a limited need water, we have an emergency stockpile of water, and you can call that number to make arrangements. It will be screened through there.
Now, what's that water number? 973? 280?
Correct.
2587?
That's right.
And that's for people who need water?
Correct.
Is there a priority on who gets water?
There is, but we will go through that priority when people call, so that no one is actually feeding us the priority after we tell them what it is.
So, but those who are affected certainly
Absolutely.
will be prioritized.
Correct. There is, with regard to meetings, all meetings of the ABC, the Planning Board, the City Zoning Board of Adjustment, the Rent Leveling Board are all canceled until further notice.
So if I have a pending matter before any of those boards, what's my status?
They will be adjourned and carried to the next available meeting date.
Will that result in any penalties against me? Result in a warrant for my arrest for not appearing? Any other kind of punishment?
There will be no escalation of fines. There will be no late penalties or interest assessed. You may still be liable for the initial violation fine, depending upon the outcome of your matter, but no escalations or interest will be charged.
And there'll be no penalties imposed while my matter is pending. I have to have a hearing first.
Correct.
And if I have an outstanding violation and I do owe the court monies now, will I be penalized or will I have to pay interest or any other penalty on top of the fine that I already owe?
You will not. Per your directive of March 13th, I have informed the municipal court and the municipal court judges that all fine escalations, non-payment penalties, and interests should be waived.
And if there's an issue with that, I refer you back to the law department to make a determination as to what your status is, and they can intervene with the courts as well. Chris, now we have over 400 employees throughout the city that work from 8:30 to 4:30 Monday through Friday normally. I know as a result of COVID-19, I've made adjustments as to the hours and the amount of people that are working on a regular basis. Please tell me, tell the public what that number is and what the spread is from Monday, Wednesday, and Friday, Tuesday, and Thursday, and then explain whether or not that's going to impact services.
Sure. First, we identified all essential employees and excluded them from this plan. Essential employees are defined as those employees who are required to work full-time and who have to be available to the city and to the city's residents on a regular basis. Overall, essential employees include all uniformed police and fire, most of DPW, and then certain identified administrative managerial employees. If they do not fall into the category of an essential employee, those employees not in that category have been divided into Team A and Team B. They will work alternate days. By doing so, we have been able in all three buildings to provide a work environment where the CDC's social distancing guidelines can be met while work is still performed. We have also indicated that the public is not allowed in any public buildings. That gives our employees an opportunity to respond to all inquiries by telephone, by email, if necessary by fax. And so all work is getting done. We are responding routinely to inquiries. There should be no interruption in the delivery of services. There will, of course, be certain actions that ordinarily you could come to City Hall to undertake that are going to be made more difficult by this situation. For example, if you're doing a renovation on your house and you need inspections or building plans, interior inspections have been discontinued for the time being. They will be rescheduled at a future date, and we will continue to monitor that. We will no longer be doing certificate of habitability inspections on the interiors of homes. We've converted that to a written questionnaire. We will not hold up a closing. We will do the certificate of habitability inspection by questionnaire, and it'll be certified under oath, submitted, and a C of H certificate will be issued. So we have attempted to make alternate arrangements for all city services and obligations to the greatest extent possible. And I would urge any citizen who is having a problem that they need to have resolved that is not getting resolved to once again call 973-280-2587, and we will attempt to either explain why we can't do it or to put a process in place to meet your need.
The city operates a hotline. The number to the hotline is 973-280-1621. But Chris, a lot of numbers will appear on the screen. A lot of people who have given their numbers, but I want an overall number under the one that I'll give ultimately. An overall number that if there's a problem, they need to troubleshoot, or they can't get through, what number can they get to the highest appointed person in the city, who is our business administrator?
973-280-2587.
That number, once again, 973-280-2587. Is that 24 hours?
Yes, it is.
And does that number reach you?
Yes, it does, directly.
And all of the services you're able to address, all the issues you're able to address and come up with these services?
I am.
Thank you, everyone, and thank you to the public for taking the time to listen to this briefing and taking it to heart. This is a serious matter. COVID-19 is serious. This is not a drill. This is a serious health emergency. It is a global one. It has already affected a person here in the city of Orange Township. We're taking this very seriously. You'll get updates on a regular basis. After this, I intend to have a phone conference this evening with all of the department heads to talk about the results of tonight's curfew. We don't expect everything to go smoothly all at once, but I want to know on the ground immediately when something happens, and I want to report out to the public as to what is going on. As your mayor, I take this responsibility very seriously and have dedicated myself to making sure that we do everything that we can to make sure that this city is safe. I live with and am married to for 20 years a first responder, a level 1 trauma center doctor at UMD&J, and she is reporting that this matter is serious. Her colleagues across the country are saying that this matter is serious. So we should undergird ourselves in making sure that we carry out all the precautions that are necessary to make sure that we're safe and that our neighbors are safe. I'm going to give a number that you can reach me directly, 862-373-0025. When all else fails, call the mayor directly at 862-373-0025. Leave me a message, text me, I'll get back to you and get on the problem, whatever it may be. I want to thank all of the directors and the employees of the city of Orange Township. These people have shown a different level of dedication to this mission of serving the citizens of Orange, and I want to thank them. We don't pay them the best. They don't have all of the best benefits. They don't have the best facilities, but they go out of their way to make sure that they serve in a professional manner, and I want to publicly thank them for all that they do on our behalf. Part of this sector that we did not hear from today was our Board of Education. I've been in touch with the superintendent of schools on a regular and daily basis. Schools are closed by mandate of the governor, but our Board of Education is maintaining some openness to make sure that our children are being fed on a regular basis. They are providing an emergency management plan as well. I do have them on the phone. I believe I have the business administrator and the superintendent. Mr. James?
Yes.
Dr. Fitzhugh?
He stepped away for a second. He'll be right back.
So I do have the business administrator on the phone. He's been listening to our briefing the whole time. Mr. James, I know you wanted to give some input into the briefing from the Board of Education. I believe we can hear him, right? Okay. Mr. James, you may go ahead.
Yes, thank you, Mr. Mayor, and the rest of the administrators. We really appreciate your work. I really appreciate your effort that you have put into this epidemic that is going on right now, in the city of Orange and around the state of New Jersey. The City of Orange Board of Education is trying its best to do what we can to support the children of Orange. We have provided opening right now at the schools to provide breakfast and lunch for the kids. But when it comes to the time of continuous lockdown or a curfew, we will try the best we can to collaborate with the City of Orange to provide breakfast and lunch for the students of Orange. I also have my superintendent here right now. He might want to chime into this discussion and give his opinion about what we're really discussing today to support the City of Orange and the community. Dr. Fitzhugh?
Dr. Fitzhugh, you there?
Yes, I am. Good afternoon.
How are you, sir? I know you're new into the superintendent's role. You really started just this summer, and now you're hit with a global crisis. Thank you for participating and keeping us in touch with all of the measures that the Board of Education has taken. We have completed our briefings and just wanted to hear from the Board of Education as to what efforts you've taken, any changes, anything that the administration can do to assist the Board of Education.
So thank you, everyone, for having us on this call. Very quickly on something we had a discussion about the emergency ad hoc information opportunity to share with me their day one reflection. They're all due by 6 p.m. Again, we have just a few minor, Wi-Fi issues. We were able to get Chromebooks to many of our families. We were able to blast out certain types of Wi-Fi capabilities from gaming systems, but also additionally with Comcast that we're utilizing as well. In addition, this morning I went to about 5 of our schools at the Franklin City, getting out to our students in Grand Bill, for all of our students in the township, the Orange Township Public Schools. Again, we have about 320 so that opportunity to have their meals today. I'll give the exact number, but I know it's over 320. Again, we're going to continue that tomorrow. I'll be at some of the schools along with our board president at Rolls Farmer to ensure that our students have the opportunity to not only see us, but also so we can give some well as well as some love for our security more currently on site every single day. And that's what we are as a township. I just sent an email to the county superintendent and the county VA as it relates to if a city was going to full quarantine, how would that look like for our students to have food every single day if in fact there were some issues with them getting breakfast and lunch on the go. And that's where we are for my office.
Okay. I know we have you on the call, Dr. Fitzhugh, but I do want to highlight much of what you said during your briefing. First, we are engaging in virtual learning for the kids, and it's happening during the day, correct?
Yes, sir.
Okay. And the principals of the various schools are calling in and reporting into you with any problems and progress. And then I know that you've had some Wi-Fi issues, and I know that the city has tried to step in as well with Comcast to make sure those issues are ironed out. We'll continue to work with you on that. And you've already served, I guess that's today, 320 meals throughout the district. Is that correct?
I'm going to give you the correct number. I'm going to get you my email and give you that number.
Okay. And then finally, you have begun your draft of the quarantine plan in the event that there is an order that we be quarantined 100%.
Right. And so I think trying to get guidance from the superintendent because he gives us those directives. So he has an email free, and I just texted him.
Okay. So the superintendent is saying that he did get guidance from the county superintendent regarding his quarantine plan. And he also thanked Chartwell, who delivers the meals to our students, and that security is at the schools around the clock, but that the schools are closed and they operate for those purposes. And to assure our residents, our children are engaged in virtual learning. We have made sure that those who did not have access to Wi-Fi, we work with Comcast to expand Wi-Fi access to make sure that our children are learning. Thank you, Superintendent, for all that you do. And I have invited you on the conference call this evening just to talk about the limited subject of the curfews and how those things are going and what we can do to improve our situation. Thank you very much. So that's it, ladies and gentlemen. If you have questions, please contact those phone numbers. Of course, you have my number at 862-373-0025. I may not answer because I'm all around the city doing a number of things, but I will get back to you. You can also text me. That's preferable because I'll know exactly how to hone in and get information to you as quickly as possible. Thank you again. Please be safe. Please observe all of the safety measures that have been put out by the CDC, the World Health Organization, and our own local health department, because that's the best information we have. That's the best science that we have today to keep us safe. May God bless you all.
Thank you, Mayor.